Hello and welcome to the Base Hospital Podcast. Today we are diving into an essential diagnostic procedure, that is kidney biopsy. This procedure is crucial in diagnosing various kidney conditions and helps in determining the best course of treatment for patients with kidney related issues. Joining us today, Dr. Kishore Kumar, consultant nephrologist and kidney transplant physician with extensive experience in performing kidney biopsies and interpreting results. In this episode, Dr. Kishore Kumar will explain what a kidney biopsy is, its indication, the preparations involved, the procedure itself, post-procedure care, potential complication, and the vital role it plays in the diagnosis and treatment of kidney conditions. Stay tuned as Dr. Kishore Kumar share expert insights into the kidney biopsy procedure and its impact on patient care.
Hello everyone, I am Dr. A. Kishore Kumar. I am working as consultant nephrologist and kidney transplant specialist at Base Hospital, Hyderabad City. Today I will be discussing about kidney biopsy, what is the procedure, what are its indications, complications, and what is the use of kidney biopsy.
Dr. Kishore Kumar, thank you for being with us today at Base Hospital, Hyderabad City. Let's start by understanding what is kidney biopsy.
Kidney biopsy is a procedure during which a piece of kidney is taken out and it is examined under microscope using variety of stains to identify what is the problem in the kidneys. It can give us a lot of information in patients with kidney problems.
So doctor, what are the indications of kidney biopsy?
Indications of kidney biopsy are mainly divided into three categories. The first one is if the patient has any blood loss in the urine. Blood loss in the urine can be two types, macroscopic or microscopic. Macroscopic means the urine is frankly red in color, whereas microscopic blood loss is something in which the blood is seen only under microscope. For a naked eye, the urine is in normal color, but under microscope there will be red blood cells in the urine. So this blood in the urine can be from the kidneys or it can be from the urinary tract. Inside the urinary tract, commonly kidney stones and urological cancers can cause blood loss in the urine. Other than these causes, blood loss can be seen in the urine mainly from leak from inside the kidneys. The leak of blood, the red blood cells which is present in the blood into the urine can happen through the filtering apparatus of the kidney. So to identify what is the reason for this blood loss in the urine, we will do kidney biopsy. The second one is the loss of protein in the urine, which is called as proteinuria. So normally protein is not present in the urine or it is present in very less amounts. If there is increased amounts of protein in the urine, it is called as proteinuria. This protein usually leaks from the filtering apparatus of the kidney due to variety of causes. So to identify that underlying cause, we do kidney biopsy in patients with proteinuria. Usually along with blood loss, there will be protein loss in the urine if there is a defect in the filtering apparatus or if there is a problem inside the kidneys. The third indication is decreased kidney function. Without any blood loss or without any protein loss in the urine, sometimes patient can have decreased kidney function. Or usually if there is protein loss or blood loss in the urine, there can also be decreased kidney function. So in a patient with decreased kidney function without any specific cause, we do kidney biopsy to identify the cause of the decreased kidney function. So how do we identify the decreased kidney function? We do a test called as serum creatinine. If the serum creatinine is elevated, it means that kidney function is less.
Dr. Kishore Kumar, what are the usages of kidney biopsy?
Kidney biopsy can give us lot of information. First and the foremost information it will give us about the underlying kidney problem which the patient is having. What is the reason? So first we will identify that. After identifying, we can give the specific treatment for that kidney problem which the patient is facing. The third one is we will know what is the extent of damage inside the kidney. The fourth one is we will come to know whether any medications will work for this patient or not, whether the kidney problem is reversible or if there is no benefit with the medications to the patient. So these are the uses of kidney biopsy.
Can you explain what are the contraindications of kidney biopsy?
There are few situations in which kidney biopsy is usually not done. The first one is if the patient is having difficulty in blood clotting, like if the patient is having some problem with their clotting mechanism of the platelet count is very less in the patients, like less than 1 lakh. In such situations, kidney biopsy is usually not done. The second one is if the patient is on some blood thinners like aspirin, clopidogrel, which are usually given to patients with cardiac conditions. In such situations also, kidney biopsy is usually not done without stopping those medications. Third one is if the kidneys are small. Kidneys are small, it means that the kidney problem is from the long duration, and inside the kidney there is no viable tissue. So in such small kidneys, the use of kidney biopsy is, in such small kidneys there is no use of doing a kidney biopsy. So in such situations also kidney biopsy is not done. The fourth one is if the patient is having any urinary infection or the infection of the kidneys, or if there is any infection over the on the skin, the site at which we do a kidney biopsy. In these conditions where the infection is present, in such situations also we don't do kidney biopsy. The other contraindications for kidney biopsy are if the patient is having very high blood pressure. If the blood pressure is more than 140 millimeters of mercury of systolic blood pressure, we usually control the blood pressure and after that we do kidney biopsy. If the blood pressure is high, we don't do kidney biopsy till the blood pressure is controlled. The other indications is sometimes there will be multiple cysts inside the kidney in patients, in few patients. In such situation also kidney biopsy is usually not done. The other contraindication is the shape of kidney in few patients is not normal. There is one condition called as horseshoe kidney. In such horseshoe kidney, normal procedure or the daycare procedure or the routine ultrasound guided kidney biopsy procedure is not done. Rather than a transjugular kidney biopsy is done by an intervention radiologist.
So doctor, what is the preparation for kidney biopsy?
Before going ahead with kidney biopsy, first we will identify whether there is any proper indication for kidney biopsy or not. Then we will do an ultrasound to look for the size of the kidneys, whether they are small or not, or if there is any urological problem like kidney stones or any urinary infection in the patient. Then we will check his blood pressure to see whether the blood pressure is adequately controlled or not. Then we will review his medication chart to see if the patient is on any blood thinners or blood clotting preventive medications like warfarin or any other medications which will prevent the clotting of blood in the patient. And other tests we do is we will check his clotting mechanism, like we will check his hemoglobin level and we will check his platelet counts, and we do his bleeding and clotting time and other tests like prothrombin time and activated partial thromboplastin time. So these are the blood tests to identify whether the patient's blood is adequately clotting or not. So after looking into all these factors, then we will admit the patient for kidney biopsy.
Could you explain what is the procedure of kidney biopsy?
The procedure of kidney biopsy is done under local anesthesia. It means that patient is fully awake during the procedure. It is usually done bedside and it is done under ultrasound machine guidance. So during the procedure, patient lies on his tummy with the back of the patient facing the roof, and after that then we do an ultrasound to identify the size of the kidneys and the site from which the biopsy should be taken, and we make a marking over the skin in the lower back for the insert site to identify the site for the insertion of needle. So after these steps, we will clean the skin surface of the patient with germicidal solutions, and we will give something called as local anesthesia, which is an injection which will numb the surface of the skin and the track through which the biopsy needle reaches the kidney. So after giving this local anesthetic, then we will take a spring loaded biopsy gun and via ultrasound guidance we will insert the biopsy needle and it will reach to the surface of the kidney, and then we will take a small piece of kidney via that spring loaded biopsy gun. After the procedure, the biopsy site is compressed for some time, and then patient is made to lie on his back.
So, Dr. Kishore Kumar, what is the post-procedure care for kidney biopsy?
After the kidney biopsy, patient should lie on his back and he should be under strict bed rest at least for 6 hours. He should not be moving in the bed. Then we will check his blood pressure and pulse rate and abdominal girth every 30 minutes. And then we will give a few transparent containers to the patient to collect the urine whenever he passes. This is to identify if there is any bleeding from the biopsy site into the urinary tract. So, after 6 hours, patient can roll in his bed if there are no complications and if his blood pressure is stable. And in the next morning, if the patient's blood pressure and if the urine is clear and if the pulse rate is normal, patient is discharged to home.
So, doctor, one final question. What are the complications of kidney biopsy?
Complications of kidney biopsy are the first and the most important and the most common one is the bleeding. So kidneys receive more than around 25% of blood from the heart. If the heart pumps 1 liter of blood in 1 minute, 250 ml of that blood will go to the kidneys. So kidney is a very vascular organ with high blood supply. So if we put a needle inside a kidney, there is a high chance that there will be bleeding. So small amount of bleeding is usually common and it is seen in up to 75% of the patients. The bleeding can be near the kidney or the bleeding can be into the urinary tract. So if patient develops bleeding into the urinary tract, the patient will have frank blood in the urine and the urine will be red color. Sometimes blood clots are seen. So usually the blood, if there is blood loss in the urine, it will be mild and there will be just reddish tinge of the urine which usually clears in few hours. Sometimes if the patient has severe bleeding, then we may have to insert a urinary catheter to remove the clots in the urinary bladder. And this type of severe bleeding is also maximum more than 90% of the patients usually clears by itself. Rarely, sometimes patient can have severe bleeding requiring blood transfusion or transfusion of the blood products. The other complication is pain. Usually this pain which is associated with kidney biopsy is mild because we give local anesthetic and it usually responds to regular painkillers. Sometimes if the bleeding is severe and it is not controlled by other mechanisms, then we may have to do a procedure with the help of intervention radiologist to identify from where the bleeding is happening and that site of bleeding is embolized or blocked to stop the bleeding. Very rarely, in less than 1% of patients, the severe bleeding may require removal of the kidney from which the biopsy is taken. So these are the complications which can happen with kidney biopsy. In more than 99% of the patients, it is usually safe and it will give us a lot of information in patients with underlying kidney problem, which can help in identifying the cause and which can help in treating them.
Thank you, Dr. Kishore Kumar, for sharing crucial information regarding the kidney biopsy to our listeners. We hope this episode has provided valuable insight for our listeners. A kidney biopsy is a crucial procedure in diagnosing kidney condition, and when performed correctly, it can guide doctor in choosing the best treatment option to protect kidney function and prevent long-term complications. If you are experiencing symptoms like persistent fatigue, swelling, or changes in urine output, don't wait to seek medical advice. Consulting a nephrologist and getting a kidney biopsy when necessary can help identify underlying issue early and enable timely intervention, safeguarding your kidney health and overall well-being. We'll be back soon with another informative episode of the Pace Hospital podcast. Until then, stay informed and proactive about your kidney health. Thank you for tuning in.